Podcasts on unc-tv.org are made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC-TV.
Dr. Tom Irons has devoted his professional career to providing clinical care to underserved people in eastern North Carolina. As professor of pediatrics and vice chancellor for regional health services at East Carolina University, Dr. Irons has worked to improve access to quality health care for the rural uninsured. Heather Burgess introduces us to the 2011 recipient of the University of North Carolina Board of Governors Award for Excellence in Public Service.
Here we come. Okay, Mama.
Hey, how are you, big boy?
Tom Irons is one of the most giving, generous, thoughtful, kind, gracious, loving human beings that I have ever known.
His life is about giving, and so others recognize that very quickly and sort of are drawn to him, and he's the kind of person, I think, that is always looking for an opportunity to do something for somebody else.
A champion for the underdog, totally dedicated to service of the citizens of our region.
Tom is public service. He doesn't see it as public service. He sees it as doing what's right for Eastern North Carolina or for North Carolina or whatever region he's working with.
He is incredibly passionate and he's incredibly compassionate. Particularly on behalf of both children, because he's a pediatrician, and also on behalf of underserved populations.
He is very forthright, but he's also got good nature and good humor, and a great spirit about him that is really infectious.
He is just one of the most dynamic individuals, and when he speaks with passion, and you're compelled to listen to him.
Whether it's teaching medical students as professor of pediatrics in the Brody School of Medicine, or his work as the Associate Vice Chancellor for Regional Health Services at East Carolina University, Dr. Tom Irons has a passion for helping people.
It's an almost unbelievable privilege to be able to be where you came from, to be able to do the work that your parents did, to be a part of their legacy.
Thomas Grant Irons grew up in Greenville, North Carolina, the oldest son of parents who were both primary care physicians. His mother, pediatrician Malene Irons, would take her son on house calls, often to tend to sick children and people who could not afford care.
I knew from at least the age of 12 or 13 that I was going to be a doctor, and that I was probably going to be a pediatrician.
His parents' passion for helping others and his mother's strong sense of social justice made an impact on young Tom's life.
It influenced me powerfully, and today, the example of our parents, and I say our parents, I have two wonderful brothers, the example of our parents is the thing I hold up and try to live by.
Even more ingrained in him is this sense that he supports the needs of the citizens of our region, and in particular those who have not had the ability to speak on their own or for themselves.
After graduating from Davidson College and then the University of North Carolina School of Medicine, Dr. Irons and his wife Carol headed for his residency in California and then North Carolina. He then served 3 years in Germany as an Army doctor. On base, he began a program to help prevent child abuse and solve social issues among military families.
We formed a child abuse committee and began to deal with those cases one by one with the meager resources that we had.
After the Army, Dr. Irons settled in Raleigh to practice pediatrics, but an affinity for teaching and community service had Irons questioning if maybe he should be doing more.
I wasn't able in that private practice setting to touch the people that I really wanted to touch most.
In the early 80s, he began a faculty appointment at the East Carolina University Brody School of Medicine, teaching residents and directing a new pediatric primary care program.
We did an expansion down there and moved into the county health department, and then I began to feel it. It was, this is, oh my gosh, this is what I love.
In the early 90s, he helped secure a grant and financial commitments that began ECU's generalist physician program to help rural communities keep doctors in their area.
Tom always keeps the patient, or keeps the people forefront. So when he's talking to you about a collaboration on a clinic somewhere, he's not talking about what his organization, what the organization wants. He's talking about, let's talk about what the needs are of those people that live in this rural enclave.
He began a partnership with the Office of Rural Health and the North Carolina Medical Society Practitioner Program that would change access to health care for thousands in rural areas.
And you go in and you look at and just diagnose the community pathology, if you will. See if you can figure out what it would take to keep a couple of doctors on the ground.
Immediately, Tom is seen as a community person. He's not seen as some vice chancellor coming out of Greenville, North Carolina. He's seen as an Eastern North Carolina man who cares about Eastern North Carolina.
During the aftermath and flooding of Hurricanes Dennis and Floyd, in 1999, Dr. Irons coordinated Pitt County's health service efforts. He saw firsthand the plight of Eastern North Carolina's low-income residents.
I looked around me and people just had nothing, nothing. If all you do is go in and take care of sick people when they're sick, you really haven't changed very much. You've changed some individual lives, but if you haven't changed the health status of the population, I don't think one should feel satisfied.
He helped begin a federally funded pilot health program for Pitt and Greene counties and formed a partnership with a federally qualified health center that provides care to the poor and uninsured. Many say it is his unique ability to bring so many to the table for collaboration that is a catalyst for change.
He's someone that draws out the best in people, but he also challenges people. He challenges the status quo.
His enthusiasm just shines, and it's sort of hard to turn down Tom when he asks you for something, and he uses it for the right purposes. He uses it to help the people in his community.
To continue that help, he began to see a vision of building a major health center in Pitt County to serve the underserved. In March 2007, the opening of the James D. Bernstein Community Health Center became reality.
Tom was able to sort of break down barriers with the community health center that was in a surrounding community. He's able to bring the resources from the university there.
It's been a godsend to uninsured people. It's been a godsend to people on Medicaid and Medicare who can't get care anywhere else.
Along with the Bernstein Center, Irons honors his collaboration with the late Dr. Leslie Bass, with his continued support at the Lucille Gorham Intergenerational Center in Greenville, where he contributes weekly by bringing faculty, medical students, or others to give back.
I'm happiest when I'm out at the Bernstein Center or over at the Lucille Gorham Intergenerational Center with my friends, because we're in this together somehow. We're struggling together somehow, and we're going to get there somehow.
Each project, each new venture in public health service is a mission for Tom Irons, MD, that makes a difference, one patient at a time.
I'm so lucky, you know. I get to be where I came from. I get to serve the people my parents served. And I get to try, if I can, to take it to a new level. I'm nourished by lots of things, probably by family more than anything. I take a lot of my nourishment from having my feet on the ground beside people in the community, good people who are trying to change things for the better.
And for his passion and actions to make a difference, the UNC Board of Governors honors Dr. Tom Irons with the 2011 Board of Governors Award for Excellence in Public Service.
That really exemplifies what this award's about, is to try to find someone who views their role in life as doing for others. And I think Dr. Irons is a terrific example for all of us, really.
We'll do what's right, we'll do it well, and we will do it together.
The Award for Excellence in Public Service was created in 2007 to encourage, identify, recognize, and reward public service by faculty of the university. Faculty of any of the 17 institutions of the University of North Carolina are eligible for nomination.
Podcasts on unc-tv.org are made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC-TV.